Hi, this is Dr. Komatsu. This is a video of the example of routine upper endoscopy. I hope this will help our fellows to learn the basics. You will see larynx and pharynx after passing the base of tongue. This patient had general anesthesia, so you can't see the vocal cords, but the observation of laryngopharynx is important, especially for the patient with risk factor of oral cancer, such as smoking and alcohol, as well as patients with laryngopharyngeal reflux symptoms. The entrance of esophagus is located slightly on the left side, so I prefer going from this side, but it's just a personal preference, so pick the side easier for you. Wash out the esophageal wall before advancing this study. You don't want to miss abnormal lesions such as color change, depressive lesion, protruding lesions. Signs of early cancer can be easily missed. Place a scope in the center with a little insufflation to observe the whole area. I usually take pictures from proximal, middle, distal esophagus and GE junction at least. The pictures are the proof of what you saw. Taking many pictures doesn't hurt, and usually patients are interested to see those. Using the universal classifications such as Los Angeles classification for esophagitis, CNM Prague criteria for extent of Barrett's esophagus, Paris classification for the tumor, and Hill classification for GEJ anatomy in the document is helpful for people to understand your findings. Using electronic chromoendoscopy technologies such as narrowband imaging from Olympus is helpful to distinguish the squamocolumnar junction. Keep in mind that the main use of this technology is to enhance the visualization of capillary network pattern for the targeted biopsy. We will discuss about it at a time. The stomach has three parts: fundus, body, and antrum. Also, the proximal stomach within 2 cm distal to G junction is called cardia. The gastric body is divided into upper, middle, and lower. The orientation is important to document the location of the lesions. Looking down, I orient the view as shown. 12 o'clock lesser curvature, 6 o'clock is greater curvature, then anterior wall is 9 o'clock, and posterior wall is 3 o'clock. The picture I took right after entering the stomach was a bad example of pictures without orientation. Advancing distally, make sure to observe anterior and posterior wall carefully. The adjustment of the insufflation is also important. Mucosal lesion can change its shape with too much insufflation. The lower gastric body and antrum are a common area for abnormal lesions. Make sure to wash out these saliva to observe whole area. The passing the pylorus can trigger gastric peristalsis, so I prefer to observe whole stomach first, but it is just a preference. The gastric angulus, as known as incisular, is common area for abnormality also, such as ulcer and cancer, so be cautious. The retroflexion view is suitable for observation of lesser curvature of the stomach compared to looking down, so observe there, fundus, and cardia. Also, this position is good to suction the fluid in gastric body since the scope is parallel to the gastric wall. Go back to looking down position for the antrum and then pylorus. Passing the pylorus is sometimes challenging, but just be patient and keep the pylorus in the center of the view with mild pressure. It will pass eventually. Too much insufflation sometimes makes it difficult. Observe anterior and posterior wall of the duodenal bulb. If you see ulcer on the anterior wall, there may be another one on posterior wall called kissing ulcer. Then turn right on the supraduodenal angle and pull the up angle to advance into descending portion of duodenum. Keep the view in the center of the lumen and gently pull the scope to adjust the axis of the scope. This maneuver will make scope advance distally. Then observe as you pull the scope back to the stomach. Check the duodenal papilla for abnormality also. After taking biopsies from lesions you found, then decompress the stomach and pull the scope out. Using narrowband imaging on the esophagus when you pull out the scope may help pick up lesions you didn't see at first. I hope this video helped you today. Thank you for watching.